What is the first word comes to your mind when we say headache? Maybe pain, screaming, light? You probably will put your hand on your head too. Headache is pain or discomfort in the head, scalp, or neck. It occurs on one or both sides of the head, and it may appear as a sharp pain, a throbbing sensation, or a dull ache. It can develop gradually or suddenly and may last from less than an hour to several days. As you can see, classification of types depend on the cause or the place. So, once we say migraine, this picture popped up in your head. Or, when saying cluster headache, you have to remember when one of your eyes starts to induce pain with some tears and runny nose. While saying tension makes you remember that time when you were stressful because an event and your head starts knocking from this area. The last type may be new for some of you, which is medication overuse headache, or we can call it rebound headache. This type occurs because of the regular overuse of acute headache medication for more than 3 months. And those the most likely areas for the MOH headache. Why we treat headache? Treatment aims to alleviate acute pain, restore normal functioning, prevent relapse, and minimize side effects. And since we are healthcare providers, we want to recommend you with some lifestyle recommendations to help you manage headache. Get enough sleep, relax and take breaks from tasks, drink plenty of water, massage your temples and neck. Beside that, we can recommend you with some supplements that might be helpful in managing headache, like magnesium. Daily doses of 400 to 500 mg of magnesium may help prevent migraines in some people. It's especially effective for migraines related to menstruation and those with accompanying aura or visual changes. Also, vitamin B2 helps prevent migraines, and coenzyme Q10 may help decrease the frequency of migraine headaches. Now, you have headache, and you want to take a pill so bad. So, which kind of pills you are allowed to take, and what dose, and how many times? We can advise you to take one of the available OTCs to manage your headache, like paracetamol, NSAIDs, or aspirin. Paracetamol is usually prescribed as an analgesic and an antipyretic. For dosing, you have to know in which age group you fall. For adults, the maximum daily dose is 4 grams, whereas the maximum daily dose for pediatric is 10 to 15 mg per kilogram per dose. Since paracetamol is a safe drug and is kind of rare to have side effects, we can mention the most likely of them, which are diarrhea, jaundice, nausea, or vomiting. But be aware, my dear patient, taking excessive amount of paracetamol is associated with hepatotoxicity, acute liver failure, and sometimes resulting in liver transplant and death. If you're asking about what lifestyle you have to follow while you are on paracetamol, simply we answer: you can eat and drink normally, and you can take it on an empty stomach. Patients who are on warfarin at a time, we tell them to limit the paracetamol uptaking to occasional use. And it is good to mention that it takes at least 30 minutes to start working and last for 5 hours, so don't rush and take another dose. For NSAIDs, the most popular to use among them for headache are ibuprofen and naproxen. Ibuprofen can be used in young children, and the dose given does not exceed 1,200 mg. And for naproxen, almost half the dose is used, which is 660 mg. We have to mention that naproxen is used only in children 12 years old and older. To be safely used, we have to assure that the patient who is about to take one of the previously mentioned medications for headache is not allergic to aspirin or able to develop a hypersensitivity toward one of them. When taking NSAIDs, be sure to take them with a full glass of water to enhance absorption. And we advise you to stop taking them if you have any signs of hepatotoxicity, like nausea, fatigue, diarrhea, jaundice, and flu-like symptoms. For pregnant mamas out there, if you are about to take an analgesic, the safest for you is paracetamol, specifically Panadol Advance or Adol. If you want to treat your headache non-pharmacologically, you can use some herbs like feverfew, butterbur, and caffeine. They are used orally and mainly for migraine. You can use eucalyptus, peppermint, camphor, and the clove typically. Also, you can use lavender, chamomile, and rosemary by inhalation. This is called aromatherapy.